Okay. Shaylin, how are you? Why don't you introduce Sarah Brown for us, okay?
Okay. Sarah Brown has received DMH services throughout the Plymouth site. Her journey has included a range of services, including emergency room visits, hospitalization, group living, and most recently living in her own apartment with supports. Sarah Brown is here to share her story of her perseverance and recovery.
Good morning, everybody. Good morning. I lived in Florida until 2008 when I came to Massachusetts with my mom and stepdad. I had a falling out with my mom, and that's when I started inserting things into my body. I ended up at Taunton State Hospital where I began a very long and hard recovery. Taunton State Hospital got me hooked up with DMH and Vivin, and a day shy later I was with Taunton State. I ended up at a 24-hour staff Spanish house in Carver for a couple of years, and then to the Evergreen House, a less restricted group home. Carver House was when a light went on in my head that I realized I needed to change my life. I started working hard at my recovery, but I still had some hard times, including self-harming. I've been going to my church and making very good friends there. I attended the intensive DBT program at CCBC in Taunton, where I was recently told that I almost got kicked out of because I wasn't participating. The staff agreed to a meeting with my case manager and it all worked out. I wanted to quit DBT, but my therapist told me that if I quit, I would be upset with myself, and he was right. Thankfully, I did end up graduating from the program. I am proud of my diploma. In September, I moved into my own apartment and began working with the Plymouth Car team. Living in my own apartment has been a great learning experience, but has had its share of difficulties. But I have been able to work through and move forward. I've learned how to live on my own and advocate for myself with the landlord and utility companies. I graduated from my second round of intensive DBT program in January. It's sad I miss seeing all my friends every day, but I learned skills to keep me healthy. DBT is one of my lifesavers because it really gave me the tools I needed to fix my life. My favorite tools are radical acceptance, Dear Man, mindfulness, self-soothe, energy analysis. I use my skills and resources to help me get the life I want. Before I came to Massachusetts, people gave up on me because I gave up on myself. But here, no one ever gave up on me. I have a strong support system. I have DMH, my church family, my good friends from DBT, and all the group homes and staff that I have and still work with. My current goals that I am working on with staff are to get my GED, driver's permit, and can see me getting a good education and driving around, going wherever I want. And I'm still learning skills to keep me well. Someday I'd like to be a peer support specialist to teach all I've learned because it works. Everyone has doubts about their capabilities to recover, but don't give up. I would like to finish with a quote that sums up my experience and my hopes for all of you. When I look back on my life, I see the pain I've endured, the mistakes I've made, and the hard times I suffered. When I look in the mirror, I see how strong I've become, the lessons I've learned, and I'm proud to be who I am.